What is inflammation? Inflammation is the body's natural defense mechanism against harmful stimuli like pathogens, damaged cells, or irritants. It's a protective response involving immune cells, blood vessels, and molecular mediators. When inflammation occurs, the affected area becomes red, warm, and swollen. The purpose of inflammation is to eliminate the initial cause of cell injury, clear out damaged cells and tissues, and initiate tissue repair. Inflammation can be identified by 5 cardinal signs: redness, heat, swelling, pain, and loss of function. In summary, inflammation is a complex protective response that is essential for healing and defending the body against harmful agents. The inflammatory response is a critical defense mechanism that begins immediately after tissue damage occurs. When tissue damage occurs, such as from an injury or infection, it triggers an immediate protective response. Blood vessels near the injury dilate, increasing blood flow to the affected area. Capillaries become more permeable, allowing fluid and white blood cells to move into the surrounding tissue. This process brings necessary immune cells to fight infection at the injury site. These changes create the visible signs of inflammation we can observe externally, including redness, swelling, heat, and pain. The inflammatory response is protective, helping to contain harmful stimuli, remove damaged tissue, and begin the healing process. This immediate response can evolve into different forms depending on the nature and duration of the injury. Inflammation is categorized into 2 main types: acute and chronic. Acute inflammation is a short-term response that typically resolves within days. Chronic inflammation is a prolonged response that can last for months or years. The key differences between acute and chronic inflammation include duration, cellular involvement, and tissue damage. Acute inflammation is generally beneficial, helping the body heal from injuries and infections, while chronic inflammation often leads to tissue damage and disease when the inflammatory response persists too long. Understanding the differences between acute and chronic inflammation is essential for grasping the broader concepts of inflammatory diseases and treatments. Acute inflammation can be triggered by various factors that the body recognizes as threats. Physical injuries like cuts, burns, and trauma damage tissues directly. This tissue damage releases alarm signals that start the inflammatory cascade. Infections by bacteria, viruses, or fungi are detected by immune cells, which recognize these pathogens as foreign invaders. Chemical irritants such as toxins, acids, and allergens can damage cells directly or stimulate immune cells to release inflammatory mediators. Radiation exposure, including ultraviolet light and ionizing radiation, damages DNA and cellular structures, leading to inflammation. Tissue necrosis occurs when cells die due to lack of oxygen or other injuries. Dying cells release their contents, triggering inflammation. Regardless of the trigger, the body recognizes these as threats and initiates the inflammatory response to contain and eliminate the danger before it can spread or cause further damage. These various triggers activate the cellular components that play key roles in the inflammatory response. Let's explore the key cellular players in acute inflammation. During acute inflammation, several types of white blood cells respond rapidly to the site of injury or infection. Neutrophils are the first cells to arrive at the site of injury. These white blood cells typically reach the site within minutes to hours. Neutrophils travel from the bloodstream to the injured tissue through a process called diapedesis, where they squeeze between blood vessel cells. Once at the site, neutrophils engulf pathogens through phagocytosis and release antimicrobial substances to destroy microorganisms. Following neutrophils, macrophages arrive at the injury site. These larger phagocytic cells continue the cleanup process. Macrophages are more efficient at engulfing larger particles and cellular debris. They can phagocytose more material than neutrophils. Importantly, macrophages also initiate tissue repair by releasing growth factors and other healing mediators. Mast cells are already present in tissues, especially under epithelial surfaces and around blood vessels. When activated, mast cells quickly release histamine and other inflammatory mediators from their granules. These mediators cause blood vessels to dilate and become more permeable, allowing more fluid and cells to enter the tissue. Together, these cellular players coordinate a complex inflammatory response. Mast cells initiate the response, neutrophils provide early pathogen control, and macrophages assist with cleanup and tissue repair. This cellular coordination ensures effective pathogen elimination while promoting the healing process and return to tissue homeostasis. Chemical mediators are essential signaling molecules that regulate the inflammatory response. Acute inflammation is regulated by 5 key chemical mediators, each with specific roles in the inflammatory process. Histamine is released primarily by mast cells and basophils during tissue injury. It causes vasodilation, allowing blood vessels to widen and increasing blood flow to the affected area. Prostaglandins are produced from arachidonic acid in damaged cell membranes through the cyclooxygenase pathway. They are responsible for pain and fever during inflammation and amplify the effects of other inflammatory mediators. Cytokines are signaling proteins released by immune cells that coordinate the inflammatory response. They recruit additional immune cells, induce fever, and regulate the intensity and duration of inflammation. Complement proteins form a system of over 30 proteins that enhance pathogen clearance. They mark pathogens for destruction through opsonization, form membrane attack complexes to directly kill pathogens, and recruit additional immune cells. Bradykinin is a peptide that increases pain sensitivity and vascular permeability. It's formed in blood plasma through the kinin-kallikrein system and works synergistically with prostaglandins to amplify pain signals. These chemical mediators work together in a complex network to amplify the inflammatory response. Each mediator triggers cascades that enhance the effects of others, creating a coordinated defensive response. To summarize, the key chemical mediators in acute inflammation, histamine, prostaglandins, cytokines, complement proteins, and bradykinin, work together to amplify the inflammatory response and recruit necessary immune cells to the affected area. Acute inflammation is characterized by 5 cardinal signs, first described by the Roman physician Celsus in the 1st century AD. These 5 signs include rubor or redness, calor or heat, tumor or swelling, dolor or pain, and functio laesa, which means loss of function. The first cardinal sign is rubor, or redness. The affected area becomes red due to vasodilation, which means the small blood vessels in the area dilate, increasing blood flow to the tissue. The second sign is calor, or heat. The inflamed area feels warm to the touch because of increased blood flow and the higher metabolic activity of cells fighting the inflammation. Tumor, the third sign, refers to swelling, not cancer. This occurs when fluid and inflammatory cells accumulate in the tissue, causing the characteristic puffy appearance of inflamed areas. Dolor, or pain, is the fourth cardinal sign. Pain occurs due to both physical pressure from swelling and the release of chemical mediators that directly stimulate nerve endings in the affected area. The fifth sign, functio laesa, means loss of function. The affected area typically shows reduced mobility and function due to the combined effects of pain, swelling, and structural changes in the tissue. These 5 cardinal signs are clinically significant as they help physicians diagnose inflammatory conditions, guide their physical examination, and monitor treatment effectiveness. It's important to note that not all 5 signs may be present in every case of inflammation. Acute inflammation typically resolves once the threat is eliminated. The resolution phase involves several key processes that actively restore tissue to its normal state. First, inflammatory stimuli such as pathogens and cell debris are removed from the affected area. Next, pro-inflammatory signaling pathways are terminated, with a decrease in inflammatory cytokines and adhesion molecules. Inflammatory cells, primarily neutrophils, undergo apoptosis and are cleared by macrophages in a process called efferocytosis. Specialized pro-resolving mediators, including lipoxins, resolvins, and protectins, actively coordinate the resolution process. Finally, tissue homeostasis is restored through remodeling, return of normal vascular function, and regeneration of damaged cells. When the resolution process occurs properly, inflammation subsides completely and tissues return to normal function. Chronic inflammation is defined as a prolonged inflammatory response that can last for weeks, months, or even years. Unlike acute inflammation, chronic inflammation is characterized by the simultaneous presence of ongoing inflammation, tissue destruction, and attempts at repair. Chronic inflammation involves different cell types than acute inflammation, with a predominance of macrophages, lymphocytes, and plasma cells. In the affected tissue, we see a complex interplay of various immune cells and ongoing inflammatory processes. The key characteristics of chronic inflammation include persistent inflammatory processes, ongoing tissue destruction, and simultaneous attempts at tissue repair. This visual representation shows the various cell types involved in chronic inflammation and their interactions within the affected tissue. Chronic inflammation can occur when the body cannot eliminate the initial cause of inflammation, or due to persistent irritants that continuously activate the inflammatory response. Chronic inflammation can result from several distinct factors. Persistent infections, such as tuberculosis or hepatitis C, can cause chronic inflammation when pathogens evade elimination by the immune system. Prolonged exposure to toxic agents like silica dust, asbestos, or chemical pollutants can trigger sustained inflammatory responses in affected tissues. In autoimmune disorders, the immune system mistakenly identifies healthy tissue as foreign and attacks it, leading to chronic inflammation. Recurrent episodes of acute inflammation, such as repeated gout attacks, can eventually lead to chronic inflammatory states. Dysregulated immune responses occur when the normal resolution mechanisms fail, leading to persistent inflammatory activation. Sometimes, chronic inflammation occurs without a clear external cause, particularly in conditions like rheumatoid arthritis or inflammatory bowel disease. Regardless of the initial trigger, all causes of chronic inflammation share the common feature of persistent immune activation, leading to ongoing tissue damage. The cellular components of chronic inflammation differ significantly from those seen in acute inflammation. While acute inflammation is dominated by neutrophils and resolves quickly, chronic inflammation features a more diverse cellular profile that persists over time. Macrophages are the predominant cell type in chronic inflammation. These cells phagocytose debris and release inflammatory mediators. In certain conditions like tuberculosis, macrophages can form specialized structures called granulomas, which wall off persistent pathogens or irritants. T lymphocytes coordinate the adaptive immune response in chronic inflammation. B lymphocytes and their differentiated form, plasma cells, produce antibodies. While antibodies can help clear pathogens, they may also contribute to tissue damage in autoimmune conditions. Fibroblasts play a crucial role in the repair process, but can contribute to tissue dysfunction in chronic inflammation. These cells proliferate and produce collagen, leading to fibrosis or scarring. While this process aims to repair damage, excessive fibrosis can impair normal tissue function. The cellular composition in chronic inflammation represents a complex balance between ongoing tissue damage and attempted repair processes. This persistent mixture of immune cells and repair mechanisms leads to a cycle of inflammation, damage, and repair that characterizes chronic inflammatory conditions. Chronic inflammation causes significant tissue alterations that can permanently change organ structure and function. First, tissue destruction occurs when prolonged immune activity damages the tissue. Enzymes and free radicals produced by immune cells cause cell death, compromising structural integrity. Angiogenesis is the formation of new blood vessels in response to inflammation. Growth factors stimulate this process, increasing blood supply to the inflamed area. Fibrosis occurs when there is excessive connective tissue formation. Fibroblasts deposit collagen, causing hardening and scarring of the tissue. Tissue remodeling results in altered architecture and function. The balance between destruction and repair determines the ultimate outcome, often leading to reduced functionality. The ultimate outcome of these tissue changes depends on the balance between destructive processes and repair mechanisms. This balance determines whether organ function can be preserved or will be progressively lost. Chronic inflammation doesn't just affect local tissues, it produces systemic effects throughout the body. Fatigue results when energy is diverted from normal bodily functions to fuel ongoing immune processes. Low-grade fever is common as inflammatory cytokines reset the body's temperature regulation. Blood tests reveal elevated inflammatory markers, such as C-reactive protein, erythrocyte sedimentation rate, and pro-inflammatory cytokines. Anemia of chronic disease develops as inflammation interferes with iron metabolism and suppresses red blood cell production. Weight loss occurs due to metabolic changes and reduced appetite, particularly in severe chronic inflammation. Finally, chronic inflammation significantly increases cardiovascular disease risk by accelerating atherosclerosis and damaging blood vessel walls. These widespread systemic effects contribute significantly to the overall disease burden and reduced quality of life in patients with chronic inflammatory conditions. Inflammation and aging are closely connected through a phenomenon known as inflammaging. Inflammaging refers to a state of chronic, low-grade inflammation that naturally increases as we age, even without obvious infection or injury. The difference between young and aging cells is striking. Young cells maintain proper function with minimal inflammation markers. In contrast, aging cells accumulate damage and exhibit increased inflammatory signals, shown here in red. These inflammatory signals actively pulsate, constantly releasing pro-inflammatory molecules into the surrounding tissues. As we age, the levels of inflammatory markers in our blood steadily increase, with a more dramatic rise after middle age. These key inflammatory markers include interleukins like IL-6 and IL-1 beta, tumor necrosis factor alpha, and C-reactive protein. Inflammaging contributes to multiple age-related diseases. These include atherosclerosis, which involves inflammation in the arteries, and type 2 diabetes, where inflammation affects insulin sensitivity. Alzheimer's disease shows neuroinflammation as a key feature, while cancer development is promoted by chronic inflammatory environments. Managing inflammation may be key to promoting healthy aging. An anti-inflammatory diet rich in antioxidants and omega-3 fatty acids can help reduce chronic inflammation. Regular exercise has been shown to reduce inflammatory markers and improve immune function, counteracting the effects of inflammaging. Stress management techniques, including meditation, adequate sleep, and maintaining social connections, also help control chronic inflammation. In summary, inflammaging is characterized by chronic low-grade inflammation that increases with age and contributes to multiple age-related diseases. This inflammatory state contributes to conditions like atherosclerosis, diabetes, Alzheimer's disease, and cancer. Importantly, inflammaging can be modulated through lifestyle interventions. Chronic inflammation plays a crucial role in metabolic disorders. In obesity, adipose tissue becomes infiltrated with macrophages. These macrophages produce inflammatory cytokines, signaling molecules that promote inflammation. This inflammation contributes to insulin resistance, a key factor in type 2 diabetes development. The relationship between inflammation and metabolic dysfunction is bidirectional. Metabolic dysfunction can trigger inflammation, and inflammation can worsen metabolic health, creating a harmful cycle. Inflammation is a key driver in atherosclerosis and cardiovascular disease. Inflammatory processes contribute to plaque formation in arteries. Inside the artery walls, macrophages transform into foam cells after ingesting oxidized LDL cholesterol. These foam cells accumulate to form atherosclerotic plaques, narrowing the artery and increasing cardiovascular risk. Inflammatory markers like C-reactive protein, or CRP, serve as important predictors of cardiovascular risk. CRP levels below 1 mg per liter indicate low risk, while levels above 3 milligrams per liter suggest high cardiovascular risk. Anti-inflammatory therapies have shown promise in reducing cardiovascular events, confirming this important connection. These treatments include statins, targeted anti-inflammatory drugs, and lifestyle modifications that can reduce inflammation and lower cardiovascular risk. The strong connection between inflammation and cardiovascular disease makes inflammation an important therapeutic target for disease prevention. Chronic inflammation creates an environment that promotes cancer development and progression. Inflammatory cells produce reactive oxygen species, known as ROS, that can damage DNA. Inflammatory mediators stimulate cell proliferation, survival, and angiogenesis, all processes that benefit tumor growth. Many cancers arise from sites of chronic inflammation. A notable example is colorectal cancer developing from inflammatory bowel disease. Clinicians assess inflammation through various laboratory and imaging tests. C-reactive protein and erythrocyte sedimentation rate are key blood markers that measure systemic inflammation. A complete blood count can reveal elevated white blood cells, with specific patterns indicating the type and severity of inflammation. As we move to more specific tests, let's examine how cytokine levels can be measured. Cytokine levels provide a more detailed picture of the inflammatory process. These include interleukin-6, tumor necrosis factor, and interferon gamma. Imaging techniques like MRI, ultrasound, and PET scans can visualize inflamed tissues directly, showing swelling, increased blood flow, and tissue changes. These various measurement techniques serve important clinical purposes. These measurements help clinicians diagnose inflammatory conditions, monitor disease activity, assess treatment effectiveness, and predict disease flares. Combining multiple measurement techniques provides the most comprehensive assessment of inflammation, enabling personalized treatment approaches. Anti-inflammatory medications work by targeting various steps in the inflammatory process. There are 4 major classes of anti-inflammatory medications, each with unique mechanisms of action. Non-steroidal anti-inflammatory drugs, or NSAIDs, include common medications like ibuprofen and aspirin. They work by inhibiting COX enzymes, reducing prostaglandin synthesis. NSAIDs are effective at reducing pain, fever, and inflammation, but they can cause side effects like gastrointestinal irritation, kidney problems, and increased bleeding risk. Corticosteroids like prednisone have potent and broad anti-inflammatory effects. They work by entering the cell nucleus and suppressing the transcription of inflammatory genes. Corticosteroids offer powerful anti-inflammatory effects, but come with potentially serious side effects, including weight gain, bone loss, elevated blood glucose, and increased infection risk due to immunosuppression. Disease-modifying anti-rheumatic drugs, or DMARDs, include medications like methotrexate and hydroxychloroquine. They work by altering immune function and reducing inflammatory cell activity. DMARDs are primarily used for autoimmune conditions like rheumatoid arthritis. They can slow disease progression, but may cause side effects, including liver problems, blood cell count reductions, and increased infection risk. Biological agents represent a newer class of medications that precisely target specific inflammatory cytokines like TNF-alpha and interleukin-6. Biologics like adalimumab bind to and neutralize these inflammatory molecules, preventing them from activating their receptors on cells. These targeted therapies are highly effective for severe inflammatory diseases like rheumatoid arthritis and inflammatory bowel disease, but can increase infection risk, cause injection site reactions, and potentially reactivate latent tuberculosis. When comparing anti-inflammatory medications, we can see differences in their specificity, speed of action, and primary uses. NSAIDs and corticosteroids act quickly but have low specificity. DMARDs work more slowly but are useful for autoimmune diseases. Biologics have high specificity and are reserved for severe inflammatory conditions. When selecting anti-inflammatory medications, doctors consider the type, and severity of inflammation, balancing efficacy against potential side effects. Newer agents generally offer increased specificity, targeting specific inflammatory pathways. For severe conditions, combination therapy may provide optimal control while minimizing side effects. Lifestyle approaches offer effective ways to manage inflammation. Let's explore how daily choices can reduce inflammatory processes in the body. An anti-inflammatory diet is rich in fruits, vegetables, and omega-3 fatty acids found in fish like salmon. These foods contain antioxidants and compounds that actively reduce inflammation. On the other hand, it's important to limit processed foods, refined carbohydrates, and sugar, as these can promote inflammation in the body. Regular physical activity significantly reduces inflammatory markers in the blood, such as C-reactive protein and interleukin 6. Health guidelines recommend at least 150 minutes of moderate activity each week. Even short sessions provide anti-inflammatory benefits. Both aerobic exercise like walking or swimming and strength training have shown positive effects on reducing systemic inflammation. Adequate sleep is essential for proper immune regulation. Most adults need 7 to 9 hours of quality sleep each night. Sleep deprivation increases inflammatory markers in the bloodstream. Even one night of poor sleep can temporarily raise inflammation levels. Maintaining a consistent sleep schedule helps optimize your body's immune regulation and anti-inflammatory processes. Psychological stress triggers inflammatory responses in the body. Managing stress is a powerful way to reduce chronic inflammation. Meditation and mindfulness practices have been shown to decrease inflammatory markers. Even just 10 minutes daily can make a difference. Other effective techniques include deep breathing exercises, movement practices like yoga, and maintaining strong social connections. The most effective approach to managing inflammation combines multiple lifestyle strategies working together. These lifestyle approaches can complement medical treatments for inflammatory conditions, potentially allowing for lower medication doses over time. Unlike short-term interventions, these approaches offer sustainable, long-term strategies for managing chronic inflammation. The key to health is maintaining balanced inflammation. Inflammation exists on a continuum, and finding the right balance is critical. Too little inflammation leaves us vulnerable to infections and impairs wound healing. Too much inflammation leads to tissue damage and chronic diseases. Understanding this balance helps explain why inflammation must be precisely regulated. Completely blocking inflammation can have negative consequences for health. This is why precision in anti-inflammatory approaches is important. The ideal approach targets harmful inflammation while preserving the beneficial aspects of the inflammatory response.